Guys, I'm gonna do a quick video, or try to make it quick, on as soon as I get this out of the way. I gotta put some updated programs in here. As you can see, that is a picture. Well, that is my L5S1 back fusion when I had my surgery going back 7-8 years ago or so. Again, as you guys know, I don't really keep track of dates too well, so 7-8 years, that's about as close as estimates as I'm going to think, unless I start pulling off surgery papers and so on and so forth. But anyway, that is the fusion. That is 2 pieces of titanium cage. They call those cages. Now what they did was, well, I'll draw you a picture, but basically these are hollow, and they take what bone they take off, they crush it up and make like a paste out of it, and then they pack it back in to these 2 pieces of titanium cages, and the bones start to grow through, as well as your upper and your lower, and then it fuses as one. Now, that's my back surgery. And how that got started was, I'll draw you a picture here. Hold on, guys. I wasn't prepared to do this with the picture, but sometimes a picture is worth 1,000 words. But I can't just sit here and not say anything either. So, however, if this is one of my discs, and excuse the picture, and or one of my vertebrae, and this is the other one, and in here I've got my disc. So what they do basically is they clean all this crap out of there. So now all you have is your 2 so-called vertebrae, you know, part of your spine. I don't know if I'm pronouncing it correctly or not. As John would say, I'm not a bony genealogist or whatever. So they take those cages, and what they do is they kind of shave off the bone up here and down here, and they kind of drill it out. And then those cages, they screw them in, because they're actually, those cages are threaded that you're not seeing. And then they screw them in to these 2 places here. They take the bone chips and things and they crush it up and they pack it back in, and eventually this all grows as one. So that's where they're at. Now by this collapsing, that's what was pinching my nerve, my S1. S1. And this was L5. L5. So that's what they had done. Now, I went in on a Monday. I was home having dinner on Tuesday, back to work the following Monday. Everything was great until about 3 months later, shit started happening. The pain started coming back, and worse than ever. Well, what had happened was, apparently, you know, when they go into your back, now I had gone to a neurosurgeon, and here's where sometimes asking questions, but if you're not knowledgeable on it, and you don't do your homework. Now I thought I did all my homework, but apparently I screwed up someplace. I went to a neurosurgeon because I'm thinking he was going to go into a little 1-inch scar, you know, opening, and go in there and take care of all this and, you know, drag that out, and everything was done. Neurosurgeon, they do little things. He used to be a brain surgeon before he did backs. Well, one of his partners apparently is a orthopedic, I guess they call them, you know, which are the guys that go in there with chisels and hammers and, you know, and take that 1-inch opening, and now you got a 6-inch opening, and they've got you spread way open, and they're in there hammering and drilling, and, well, you know what, the more of this they're doing, the more chance of scar tissue, because they're ripping and cutting into muscles and everything else. Well, that's what's happened to me. I'm going to try to keep this short, but I got to tell you a little bit of history. When I started having my back problems back in the 90s, I had gone to my doctor, and he would prescribe me a script for 15 Vicodins. Now I may fill that script 2-3 times a year, maybe. You know, maybe. You know, if not, none. You follow? So very, very seldom do I even have to take them. If I was having a real bad day and I knew I had to get to work, I knew I had to run the course with these guys for a while, I would take a Vicodin, all right? But that doctor since retired. I went to a new doctor. He tells me I can't continue taking these at the most 45 Vicodins a year because it's just something I can't do. They're no good for me. That I have to start thinking about other ways. Well, I've tried therapy by 3 different therapists. I tried in-water therapy. I've tried acupuncture, chiropractors, you name it, I've tried it. So when I told him this, he says, you may want to think about surgery, And after seeing 5 so-called specialists, that everybody talked about, when I asked, I narrowed it down to this one that was a neurosurgeon, to find out that, yes, he was in the operating room, but his associate, the bone doctor, apparently was doing all the work. So, needless to say, here it is 7 years later, and because of the scar tissue, my original pain coming from S1 and scar tissue coming into play, now I have pain in S2 and S3, which is causing pain throughout the whole leg, down underneath the cheek, up under between the groin and all that area. So at this point I am now in constant pain 24/7 because of the surgery. Now, when I talked to my doctor, the one that told me that I should think about this, and that I can't stay on 45 Vicodins a year at most, he says, well, you'd never know where you would be if you didn't have the surgery. Well, this is true, because you know what? I've known people, or not known them personally, but heard of them, to where they haven't had back surgery, and the next thing you know, they lose control of their bladder, they lose control of their bowel movements, they're wearing bags for the rest of their life, and they had to have surgery again anyway after that. So, at that point, I really didn't know. Who's gonna know? Nobody. But I can tell you what happened after the surgery. After the surgery, the scar tissue went back to S1, which was my original problem. That's what this here was supposed to correct. And the scar tissue continued to grow to S2, S3. Now, how we found that out was when I went to pain management, because my doctor no longer wanted to give me medication, because when I went back to him because of the pain, he puts me on 3 Vicodins a day. And I says to him, Doc, I says, when I was taking possibly at tops 45 a year, now you've got me on 3 a day. Why are they any better for me now than they were before? Now I'm on a roller coaster ride. I'm up, down, up, down, up, down. I says, this isn't for me. So after a while, and 2 other meds between these, he turns me over to pain management. And I really didn't care for pain management at the time, because my thought on pain management was a lot of that was for drug rehab. And that was just ignorance on my part, because it's not necessarily true. There's a big part of that, but there's also pain management, but the pain management guy I go to is a little bit different than the pain management guy that the drug rehab guy would go to. They could both do the same job, but just that it's a different type of clientele. So at that point, I end up with pain management. First thing they want to do is get you off pain. So he puts me up on the table and he gives me a shot in S1. And it seemed to do pretty good. So that was okay until what he gives me starts to work, because it took a couple, 3-4 days for the medication that he gave me to start to react. Well, after a while, the pain started coming back, and I'm talking a few months. I go back again. He goes, well, let me give you another shot. He says, I can give you like 3 or 4 of these shots, he says, before, I can't give you anymore. He says, and sometimes they'll last for, years, and sometimes in this case, they don't last at all. Let me give you another shot. So he gives me another shot in my S1. And when I get up, I'm saying, it didn't work. I'm still in pain here, guy. He goes, you know what, go sit in the waiting room, have a cup of coffee, let me see another patient or so. I'll call you back in and we'll see if you're still in pain. You know, so all right. So this goes on. I'm still in pain. He says, jump up back on the table. I jump up on the table. He gives me a shot in S2. As soon as the shot was done, the pain was gone. He says, Doc, this is great. Good deal. Could it have been this all the time? He goes, no. He says, it sounds like scar tissue. He says, it came back, hit S1, now it hit S2. I said, oh, great. Big deal. Here we go. All right? Great. Well, I made it through like a year and a half, 2 years. Again, went back for a couple shots. And he would give me the shots in between medications sometimes to help through that. And after these 2 shots, nothing happened. He had to give me another shot. We tried S3. Gone. Pain's gone. So now we confirmed that S1, S2, S3 have been more or less under attack by scar tissue. And arthritis set in on top of it all. Now, am I saying don't get surgery? Not at all. All right? I'm just saying do a lot of homework on it. Think. Really think about who you're going. Ask the questions. I don't know it all, but I can tell you my experiences. If you want to contact me, I'll be more than happy to tell you, because I can't tell you everything in 15 minutes or even in a half an hour, on a video anyway. But at that point, that's what happened. Now, let's get to the medication for a minute. Pain management is there to help you. They really are. But they're not just going to give you drugs, because they don't know if you're an addict looking for a fix or not. So, you know, they kind of work with you a little bit first. Well, it got to a point to where he gave me some medication, and he gave me 40 milligrams of a medication. And I started taking them, and about 3 days later, I was a zombie. You know, I didn't care. I didn't want to get up. I didn't want to go to the range. If I got up, you know, it was maybe to make something to eat. You know, if the house was burning down, I didn't care. You know, it was really not me. And I started to realize this, you know, and my wife was telling me as well. And I'll tell you a story about that if I have time. I'm going to try to step this up. So anyway, what I started doing was, you just can't cut yourself back. In other words, from 40 to say 20. There's nothing wrong with cutting yourself back. Even if you're addicted to the drug, there's nothing wrong with cutting yourself back if you do it right. The thing is, if you take medication, you have to be in charge of it, not it in charge of you. So, what I started doing was, I cut back 5 milligrams a week. This gave me a chance for it to wear down in my system a little bit, to see where the pain was coming back up. So as the drug started coming down, how far up is the pain going to go? And then the following week, I'd cut back another 5. So now I'm down to 30 milligrams. The pain started coming up a little bit more. Well, I was able to cut myself down to 20 milligrams a day. I am in pain, but it's a pain that I can deal with. Now, if I have a bad day and I do a lot and I overwork myself, the pain gets a little carried away. Sometimes you guys may notice, I don't know, sometimes I mumble a lot. That's because I'm having a bad day and I'm just trying to get through it. So I'm trying to like, blah, 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 to get done. You know, or at that point, you know, I'm just trying to get through the day, basically. So, like I say, just because they offer you 40 and you start on 40 doesn't mean you have to stay on 40. Work it down. Now, if I had all of a sudden dropped 20 milligrams, you know, saying, oh shit, the next day I feel great, I'm going to drop another 10. You know what? In about 2 weeks, you're going to be back in so much pain, you're not going to know what happened. And then you're going to have to go through all this crap again to get your stuff in your system to start working it up. So get your full tank. And then work it down a week at a time. 5 milligrams in a week until you find that threshold to where you can deal with it and function as a human being. All right? And that's what I did. Now, with the wife, this ain't going to work. Well, I'll make it quick. It's not going to happen. Let me go back to another part.